Morris, and I'm the mediator for the Great Debate. Today we're going to be debating the healthcare systems of Canada and the United States of America. I'd like to introduce our two opposing teams. Pro-Canada, we have Carrie and Heather. Pro-United States of America, we have Tatum and Cassie. They're going to be debating things such as insurance and the healthcare system as a whole. Let's see who wins. Let the debate begin.
Woo! Team Canada! Go US! Team America! One of the main things about Canada is we have to give honor to Tommy Douglas in 1967. He is the father, the fourth founding father of Medicare. So what Medicare is, it gives all Canadians equal access, whether you're rich or you're poor, to a comprehensive healthcare system, whether it be medical, dental, and drug plans. So how that works is in Canada, the federal government sets up a budget for every province to obtain a certain amount of money to cover certain healthcare costs, whether it be hospital insurance, whether it be just a doctor's visit. Everybody is equally covered regardless of status. So therefore, I say Canada has a very good healthcare system in place, better than the US, because in the US, they have something like Medicare, but it isn't accessible coverage. They have to pay out of pocket. And when they do pay out of pocket, it puts them in a great debt. I also know that in America, it shows that 52% of Americans suffer because of not having proper health care coverage put into place. Like, I don't know how you would even debate an issue like that, given that Canada doesn't even have to come out of pocket.
Free? Healthcare is not free in Canada.
Of course it's free.
No, it's not. You guys pay higher taxes. It's not free. Nothing's ever free. Taxes come out of your pocket. People who are higher class pay more because they make more. They pay more taxes and they pay for more healthcare coverages. You guys pay 13% in taxes compared to us as the U.S. We pay 8.25 in taxes, so that's almost double. You guys suffer spending cuts and important places that U.S. cherishes, like education.
Education? That's not even like education. I don't see how education would even be an issue, because I can look at, it takes 2 years, let's say, for a nursing student in the United States of America to finish a nursing program, which I don't think they have a vast knowledge of the healthcare anyways, where to be an RN, a registered RN or BN, it takes 4 years. Do you know what this stands for? Let me tell you. Not only Tommy Douglas, but also with Canada as a whole, we have who is responsible. I say that the federal government is responsible, and without the federal government, we wouldn't have a system like this to guard our people in Canada. And simply, I can look at it in Canada, thanks to Tommy Douglas and the federal government, as well as the province. We have 13 systems in place. We have portability, so it doesn't matter where we go. In this wonderful world of Canada, we're covered regardless of the fact you guys in America can't travel state to state and be covered. Every state has different coverages. Every resident of America has to come out of pocket. I know President Bush, back when he started, or his father started, healthcare was sort of what you call the focus word, let's say. And now we're sitting in 2012, and Obama is too busy cleaning up after Bush that he can't even focus or even give Americans a promise that healthcare is even going to be free or lowered or subsidized by anything. A lot of Americans right now, as it stands, are afraid to go to the doctors with concerning problems, or they go and the wait times are just ridiculous. They sit in the waiting room. They had something, I believe it was on YouTube, on one of the news broadcasts in Manhattan, New York, where a lady came in with classical signs and symptoms of a heart attack. She was met by a triage nurse, sat there for 4 hours, dead, and it took them how many hours to even realize that the woman was dead? Well, in Canada, the wait times, yes, it's something that we are working on, but you better believe that we are taken in immediately, we are assessed appropriately, and we don't walk out of there with a bill.
insured doesn't mean that they still don't receive care. They do. There's such thing. 55% of Americans are already covered with health insurance plans. The rest of them, there's private hospitals. Nobody gets turned away.
Nobody gets turned away.
You receive care if it is an absolute emergency, it's a life or death thing. You're gonna receive care. There's a competition between hospitals in the United States because of the fact that you do have to pay for health insurance. So why would you go to a crappy hospital compared to a nice hospital and spend your money there? It's almost like a competition between hospitals. You get better doctors, you get better service.
So, if Canada's so bad, why does the U.S. private insurance plan serve Canada, meaning that Canada doesn't have 2 feet to stand on because it can't support the people in its country?
But yet 82% of the Canadians prefer the healthcare system in one of the U.S. 10 times as many as 8% state preference for the style of the healthcare system in Canada.
Yes, good point. I know 46 million people don't have coverage, but the Canadian health insurance is being totally abused. People are dying all the time due to preventions, like lung cancer from smoking, like stuff like that.
Wait. We have what you call in Canada the PHAC, and what that is the public health. What they do is they implement ways to better Canadians' health. So you have the whole Canada Health Act's mission and motto is to make it a healthier country, the healthiest or one of the healthiest countries in the world, and healthy Canadians and coverage for all. So what they did is mandate participation, which you'll see all over our advertisements on TV, whether it be on the bus, whether it be on our television screen, whether it be in malls. We advertise always to betterize your healthy living. If it's not putting things on tobacco, cigarette smoking, as to why you shouldn't smoke, what it does to you. If a grossed out heart doesn't look disturbing to you, then I don't know what is. But our healthcare system encourages people to live better lifestyles through avenues such as participation, through restaurants or media attention, to get people in better health so that they live longer and don't have to always rely on the healthcare system. Yes, you brought up a good point that we do abuse our system. We do abuse it to a point which in the end, the bottom line is, rich or poor, we're all still covered. There are areas and limitations to our system that we are working out. With America, as you knock on the door, you don't have the money, the door gets closed in your face. There is no debate, there's no limitation, there's no coverage.
Yes, and that's a good point. But you gotta understand, you guys are paying all your money in taxes for things that can be prevented so that people can kill themselves. Unlike the U.S., they're not gonna pay for somebody who can smoke, which doesn't need to get lung cancer and to die.
But they have a stat that says 90% of Canadians, which is a true stat, possibly not a pro for Canada, but 90% is preventable measures. They can correct these things. And these are things that the Canadian healthcare system is trying to put into place. The provincial and the federal governments are looking at ways to enhance that aspect of our healthcare system so that we don't necessarily no longer follow the biomedical model, but we're now following the wellness model. And this is encouraging and promoting healthy living. Where in America, I can go to America and I can see more McDonald's ads than I can see your child should exercise, 60 minutes every day. I'm seeing how enjoyable is a Big Mac.
Yes, but why is the leading cause of death in Canada lung cancer and heart disease related to obesity? No, in America we don't cover everything or much really, but we are trying to force people to live healthy. We don't want to have middle class families having the burden of paying higher taxes in order to pay for other people's mistakes, smoking, obesity.
Like I said, it's McDonald's, and you're right. Lung cancer is one of the leading causes, and these are things that Canada, like I said, it's not a perfect healthcare system, But I personally, being Canadian, and from the standpoint of having, surveys done to see how our system is, we're in Canada always looking for ways to better our system. And on that note, I would say that
20% of the Canadians spend out of their own pocket. As per the U.S., they spend 52% out of their pocket because Canadian provides universal coverage to all its residents through the healthcare insurance.
that's right. So I think 27% to 52% is substantial. So therefore, it leaves the Canadian system with, and I'm not saying at all that America doesn't have a leg to stand on, maybe it's a peg leg, but the Canadian system, in my personal opinion, is stronger because out of pocket is what is the biggest drive right now. I think Americans are driven on money, and I think Canadians are more or less driven on a healthier lifestyle per individual. So with that said, I would conclude our debate for Canada.
All right. Well, you made some pretty valid points, and I thank you very much.
Thank
Karen.
you.
Thank you, Heather. Thanks for letting us be on your
Thanks,
show.
Sam.
Thank you.
Thanks.
Thanks.
And there you have it. What a debate that was. It's pretty clear that Canada and the U.S. have their different views on the healthcare systems. Canadians, they seem to have quality for the healthcare. It's cost efficient to everybody, so that way everybody can afford it, and there's access to all who are eligible. The U.S. needs to get on board with the way the Canadians do things. They need to. We need to do something today, so that way healthcare is more even between the two different countries. So in my mind, I think that Canada won just because everybody's included. Whereas the U.S., they did bring up some pretty good points about how you can get in to see doctors quicker and stuff, but then that means people who are rich have better benefits compared to the poor, and that's not really a very fair way. Thank you very much, and have a great day.